Welcome to The Explainer. Today, we're taking a look at Memantine, a really unique medication used for Alzheimer's disease. We're going to uncover the clever science behind how it works, almost like a smart guardian for the brain.
So let's just dive right in with the central puzzle here. How do you deal with a brain chemical that is, at the same time, both a friend and a foe? I mean, it's essential for memory, but in this case, it's also destroying it. That's the core problem we're going to unpack.
To really understand the solution, we first have to understand the problem. So let's go inside a brain that's under siege from Alzheimer's and see what's actually happening at a microscopic level.
Now here's the crazy part. The culprit isn't some foreign invader, it's not a virus. The damage is actually being done by one of the brain's own chemical messengers, a neurotransmitter called glutamate. Normally, it's absolutely vital, but in Alzheimer's, it's gone rogue.
Okay, so what exactly is glutamate? And how does something so important for learning and memory suddenly turn toxic? Let's break down this chemical double agent.
You can think of glutamate as the brain's mean go signal. It's the star player when it comes to forming memories and helping our brains learn new things. And it does its job by plugging into these specific docking stations on nerve cells, which are called NMDA receptors. In this slide shows the absolute core of the problem. You see, a normal, healthy brain signal is a strong, clean, quick burst of glutamate. But in an Alzheimer's brain, damaged cells start to cause this constant, low-level leak of glutamate. It's just like a dripping faucet, a relentless background noise that makes it impossible to hear the real signals.
So what happens with that constant drip? Well, it leads to this devastating process called excitotoxicity. It's as bad as it sounds. Those NMDA receptors are basically propped open all the time, which lets a flood of calcium pour into the nerve cell. A little bit of calcium is good, but this much is just plain toxic. It's like a slow poisoning from the inside that eventually causes the cell to break down and die.
Okay, so if this glutamate drip is the problem, how in the world do you stop it without, just shutting down the whole system? How do you block the bad stuff without also blocking the brain's ability to learn? Well, this is where Memantine comes in.
Now that might sound like a bunch of scientific jargon, but the magic words here are low affinity. That is Memantine's superpower. It means it doesn't grip onto that receptor too tightly. And that, it turns out, makes all the difference.
And here's why that's so brilliant. A high-affinity drug would be like welding the faucet shut. Yeah, the drip stops, but you're not getting any water ever. It blocks everything. But Memantine is low affinity. It's more like a temporary plug. It's just strong enough to stop that toxic drip, but then, and this is the genius part, when a real, important signal for memory comes along, that strong burst of glutamate is powerful enough to just knock Memantine right out of the way, letting the message get through.
This quote just nails it, doesn't it? It's a selective blockade. It fixes the stuck faucet, but it doesn't turn off the main water supply. It protects the nerve cells from that chronic damage, but it still lets them do their job when it really counts.
All right, so we get the science behind it, which is pretty cool. But how does this actually get used in the real world, for real patients? Let's look at the who and the what of treatment.
So, who is this for?
Well, its main officially approved use is for people in the moderate to severe stages of Alzheimer's. And because it works in such a different way than other medications, you'll often see it used as part of a combination therapy, kind of tackling the disease from multiple angles at once.
Now, you don't just jump in at the full dose. That would be too much for the brain. So doctors use this very careful stepped approach called titration. The whole philosophy is start low and go slow to let the body get used to it.
You can see here how it works. You start off week 1 with just a tiny dose in the morning. Then, week 2, you add a little in the evening, and you just slowly, gently increase the dose over a whole month until you reach that standard maintenance dose.
All right, let's talk about the last and maybe the most crucial pieces of the puzzle, the potential risks and, really importantly, what the realistic expectations for this treatment should be.
Now, while it's generally tolerated pretty well, Memantine can have side effects. The most common ones you'll see are things like headaches, confusion, and constipation. But dizziness, that's really the one reported most often, which is another reason that whole start low, go slow titration schedule is so important.
And this right here is probably the single most important thing for patients and their families to understand. Let's be perfectly clear. Memantine is a treatment for symptoms. It is not a cure for Alzheimer's disease.
So success with this medication looks a little different. The goal isn't to turn back the clock, it's to try and slow the clock down. The benefits can be modest, and they definitely vary from person to person, but for many, it's an incredibly valuable tool in managing this disease.
So, to sum it all up, by acting as that smart guardian for the NMDA receptors, memantine offers this really elegant, scientifically sound way to shield the brain from that constant, low-level toxic damage that is such a hallmark of Alzheimer's.
And that leaves us with a final thought to chew on. This approach focuses on managing the consequences of the damage, on protecting what's still there, rather than trying to undo what's already been lost. It really makes you wonder. Perhaps the future of treating these devastating diseases isn't just about finding one single cure, but also about inventing more of these clever ways to guard and preserve the functions we still have.